time I was here, we had to kind of cut the class short. And I promised that I'd kind of cover everything, maybe like a condensed version at least, so that we don't miss out on the rest of that session. So I talked to Nancy about it. She was fine with it. She said that we could go to 2:15 today and then go to exercise, because that can go, it's 45 minutes, so she said you'd still be done in there by 3. We'll get through as much as we can, as fast as we can, and then if anybody needs to leave, right at 2, that's totally fine too. Because I know you guys usually have questions and everything, and I don't want to speed through to where you can't get your questions answered too. I figured we'd jump right in. I'm hoping you all had the time to read the rest of session 2 on nutrition in this book right here, The Living Well with Diabetes. And that reading will help you answer what I'm about to ask, along with, I know Frank, you have your Humana plate with you, so it might be easier for you to answer these questions, but we're gonna look at the screen, or you also have this image in your book too, and if you're already on it, tell me what page it's on.
42.
42, thank you. Okay, so here's what we're gonna do. I want you all to look at this picture, and we're gonna break apart this cheeseburger and decide what parts of the cheeseburger go on which parts of the plate.
Okay.
So remember, this is also on page 42 of your book, so you have a closer image to look at. And I'll just have you all go ahead and shout out which part of the hamburger and what part of the plate it goes on.
Protein is the patty. Veggies is lettuce, tomato, and pickle. Is there onion? Honestly,
All right, so let's talk about the protein. Right?
Red onions on it.
So if we think about the sources of protein that we want to be eating, and I know you know this answer, with type 2 diabetes, does this red meat patty count?
With the protein?
Here's your protein, but you prefer having beans.
Protein and the cheese.
Does it go on the diabetes plate?
The protein and the cheese.
No, it's meat though.
Red meat is not part of the type 2 diabetes nutrition.
Well, supposed to have it well done.
Thank you.
Nope. So this is not a trick. This is just to see how much we took in, and I know we had a lot of distractions for this nutrition class. So, and if you didn't read the rest of the nutrition chapter, that's fine. We're going over it today. You can read it later on and review it all. But lean protein is what's on this list, and red meat is not part of it.
That's a lean hamburger meat.
Still not on it.
How about if you had a turkey burger?
Turkey's still better than red meat, if it's lower fat.
Okay.
Yeah,
If you look at the hamburger, it's loaded with fat.
right. That's
Because they have
exactly
to mix it that way.
right. Exactly. So that's the key. If you have type 2, and again, I'm not here to stress anybody out. I'm also not here to tell anyone what to do. What I do is I share information and I share current research, and then you guys decide what you want to do with it. But the more intense you change nutrition, the more intense your changes will be with chronic conditions, okay? It's kind of, the dosage. If you have a better dosage in your medicine, then your chronic illness gets better, right? Basically. So with the food being your medicine in this case, the more lean protein you get and the more plant-based protein you get, the better your blood sugar numbers will be long term. Does that make sense? Go ahead, you had a question?
I see the bacon on is full of saturated fat.
Yeah, so that's not on the list either, so
Pork,
this,
you got pork.
so some of these things in this picture we're putting to the side. Not everything's gonna make it to the plate, and that's, I think, where I confused you, so I'm sorry about that. All right, so keep going, what else is on there that can go on the plate?
Lettuce and tomato.
That's right,
And the onion, it is a red
The
onion.
pickle, I think there's a pickle there.
Yeah.
yep, so the tomato, the lettuce, and the onion can all go on the non-starchy
Yeah, red
veggies.
onion. Red onion is right there.
Can anything else from the hamburger go on the plate?
The bun.
Did anyone say the pickle?
Yeah.
Oh, sorry, I missed it.
I think we can leave that on there. It doesn't really go on the plate, but we can leave that on there.
You can take off the sauce and the ketchup.
Yeah, so pretty much there's only 3 things from this hamburger that can go on the plate and be qualified for good nutrition for treating diabetes, right?
The pickle is 0 calorie, not Weight Watchers.
Right.
0 points.
Yeah.
FYI.
So we're leaving the pickle just because it's okay, but it doesn't have a place on the plate, but it's still okay.
Okay.
But we already decided that the lettuce, the tomato, and the onion can go on the plate, and that's about it.
Not much.
So why wouldn't the bun qualify for the grains on that top right corner?
Got sesame seeds.
So let's
Yeah,
the best
it's
part
That's right, it's not a whole grain. Yeah, it's white flour.
What if you have Ezekiel?
Yes, so that's what we're gonna talk about next, is how to make this cheeseburger healthier. What are some things we can change?
Whole wheat bun.
No,
No,
Oh,
I'd wrap mines in lettuce and maybe put
Right.
some spinach in the middle.
Add some spinach, yep, that's a good way.
Make it turkey patty.
Yep, you
instead
can
of-
do the low-fat turkey, right? So like when you buy the ground turkey in the store, you wanna make sure it's the 93% or, lower fat, right? 93% lean or even leaner, not just ground turkey by itself,
Right.
because they can throw all kinds of things
Stuff
in
in
there. Yeah.
Make it
Did
low-fat
you have your hand
cheese.
raised?
No, I said true.
Oh. Go ahead.
now, I hate to break you folks' bubble, but whole wheat, sometimes it's sprayed
It's not good
with
for you.
Roundup.
Right.
Yeah.
Oh, no.
Here we go, the rabbit hole. We can't avoid it. We can't avoid it, right? Yeah,
To preserve it.
yeah.
Don't use whole wheat.
Go ahead.
Whole wheat's not good.
It's not good for you. Just like the
Gluten-free, you
white.
said?
No, he's, what it is.
I use sourdough.
Okay. So to answer your question first, it depends. Because sometimes when you look at a gluten-free label, there's a lot of other stuff in there too, right? And there's also a process involved to remove gluten from products, which makes it more processed, right? So if you work with a nutritionist, I think you said you did, right? No. Okay, I was gonna say, work with whoever your healthcare professional is and ask them to help you find some choices that are healthy that are also gluten-free, especially if you have an allergy, right? Because you might not be able to do the whole grains if you're gluten-free. But if you work with a clinical nutritionist, they can help you find choices that will keep you safe. Yes, great point.
How about low-fat cheese? No, there's no place for cheese?
There
Really?
you go, right here, low-fat cheese.
Okay,
I love cheddar cheese.
I do too.
all right, so let's talk about the cheese thing, okay? So this book is more based on like the Mediterranean diet, okay? And that's a great diet for diabetes because you can honestly see some pretty big changes from that. More research, I didn't write this book by the way either, but more research has come out since this And that's why I always have you have a pen, because now the research is showing that anything saturated fat from an animal is not helpful for diabetes. For that, remember the insulin resistance we talked about in the very beginning and how that happens? So regular cheese is part of what can cause that insulin resistance. But then you talk about low fat, which is great because it doesn't have the fat, but then what do they do to make it low fat?
Move on.
Then we're talking about processing again, right? So remember, we also talked about close to nature, right? Or as close to nature as we can find, that's what we want. The least processed foods we can get our hands on.
Can you have cottage cheese?
You can do whatever you want.
I'm just wondering.
Yeah, that's very good.
Everybody's trying.
Yeah, exactly. And I've been bringing this up a lot lately, B+ students is all we need to be healthy, right? We don't have to do A+.
Okay.
We don't have to be perfect, and trying to be perfect causes stress, which is also not healthy, right? So we want to try to get dairy and saturated fat as much out of our systems as we can, but there's some forms of saturated fat or yogurts, things like that are not going to kill you. You know what I mean?
Yeah.
So it just depends on how intense you want to get.
Okay.
So I know I've mentioned the American College of Lifestyle Medicine. I think you guys, if anyone's interested in learning more about that, if you just go to lifestylemedicine.org, you'll see where all this research comes from. But what their research is showing is that if you go plant-based and you stay pretty strict about all 6 pillars of lifestyle, which is nutrition, exercise, stress management, social connection, sleep, and avoiding toxic substances. There's 6 areas of lifestyle we can work on. They say if you work on all of those intensely, that it is possible to reverse type 2 diabetes. But that's only if you do it intensely and under a doctor's supervision, right? Because you want somebody managing your medication too. That's very important, like life-saving important. So that's why we always say anything that you decide to do to be healthier, you always do what first?
And the 6 stages are vegan?
Let your doctor know. Go ahead,
The
sorry.
6 stages are vegan recipes?
Lifestyle medicine, nutrition, physical activity, stress management, social connection, which I don't think any of you have to worry about because you have this place, restorative sleep, and avoiding toxic substances like alcohol and cigarettes, and chemicals in the home. So if you work on all 6 of those, as well as you can, B+ student, your chances become lower of having a chronic illness that's not able to be managed.
What was the last one? I'm sorry.
Avoiding toxic substances, maybe?
Substances, okay.
Yeah.
Is it too late at my age to reverse it? I'm going to be 79. No? Okay.
No. So back to that whole thing on insulin resistance that we talked about in the first, I know it was a while ago, but it's in your manuals under session 1 if you ever want to review it. But it depends on how long you've had diabetes too, and if it's been under control or not, how your pancreas is doing, because sometimes if people stop making insulin, it's way harder, to reverse. If somebody's in beginning stages or pre-diabetes, yeah, that's pretty easy.
I've been diabetic since 2008. So
Yeah,
it's been a long
so
time.
the length of time doesn't matter as much as how severe the insulin resistance has become, really. Yeah, that's an excellent question. No matter what, even type 1 can be improved. I think I mentioned that the client I had back when I was a trainer, he had type 1 and he was able to cut his insulin in half So you can still improve diabetes even if it's type 1, and you can always improve type 2, always. But it just depends on the person as far as reversing. Yeah, sure. I just want to go over alcohol facts so you had these. So,
What page is that?
this is after the recipes. Page 51. So like Mediterranean diet is going to ask you to limit to 1 drink per day. And just so nobody takes a bottle of wine and puts a straw in it.
Don't look at me.
Make sure. I avoided eye contact with you when I said that. I just want you all to know what a serving is, right? We have 1 to 1.5 ounces of liquor, which is a shot. Like that's the hard stuff. Like Karen, they have been talking about tequila since you were here. And I have to show you the notes that Frank took.
Oh, he showed.
Oh, he did. Okay. Just making sure. I think that's all they remembered.
Yeah.
12 ounces of beer is 1 serving, and 5 ounces of wine is 1 serving.
So I usually have 1 red wine a night. So
Okay.
according to this, I can get 2.
Okay. So, yes.
Stick to your one.
They do say, the new research also says that once you hit age 65, men and women are both at 1 per day.
Man.
But, again, if we're trying to do like intense changes, they're saying 0. I'm only sharing research. Again, I'm not telling anyone what to do. That is not my job. I'm just here relaying research to you. I want you all to like me when this class is over. I don't know if that's going to happen or not. But I wanted to show you the difference between brown rice and white rice. There's not a huge difference in some areas, but there are larger differences in others, like the calories. So you can see looking at brown rice, and this is on page 52 if you want a closer up view, but for example, number 1 thing you want to do is look at the serving sizes, right? These have the same serving sizes, but you know, you ever looked at a product and it says, oh, it's only like 3 grams of sugar and you know, it's high in fiber and it only has 70 calories, but this bottle has 3 servings in it, right? So you'd be having like 18 grams of sugar. I just want you to get used to looking at the nutrition facts. So always look at the serving size first. Look at the servings per container so that you know you're not tripling. Like if you eat this whole thing of rice, you're tripling this recipe, right? Or this nutrition facts label. So the brown rice has 30 less calories than the white rice. Total fat, pretty similar. Sodium in white rice is a huge difference.
Wow.
So
Sodium is salt.
yes. So that's a big one, so especially
That's
if you
in
have blood
natural
pressure.
rice.
That's in the white rice, yeah. Not all white rice, but this is what you want to look for on labels, right? It just depends on who's making it, right? What company makes it. Carbohydrate, a little higher in the white rice. Fiber, a little lower in the white rice. White rice has 2 grams of sugar. Protein's pretty similar, give or take a gram, but I want you guys to just get used to looking at everything on a label, especially the serving size. But below the label, you need to look at ingredients,
I
right?
did that when you told us, because I told you I was taking low cholesterol butter. You said,
Right.
look at the label. I did.
Good.
It's got a lot of that stuff. You don't know what it is in there.
Yeah,
Which surprised me because
yeah,
it's supposed to be good for my cholesterol.
yeah, I know. Yeah, it's, it can kind of frustrate you sometimes, I think, in the grocery store, because you see the front of the label,
Yeah.
and it's like, this looks really healthy and good for me, and it says lower your cholesterol and high fiber and all natural or whatever. And then you turn it over and it's like all these chemicals, you have no idea what they are, right? But companies can unfortunately get away with that stuff. They can call something, you know, good for cholesterol when it can cause cancer, you know? It's just, I don't want to say mind games, but it can be easy to be tricked in that sense. Go ahead.
What about wild rice?
If it's as close to nature as possible, yes. It's all about the ingredients, because sometimes you can get a wild rice and look at the back and it's got a bunch of chemicals in it. Sometimes you can look and it will just say whole grain wild rice, and that's the one you want,
Okay.
right? Yeah, so I wouldn't look, and this is, I'm not ending class, that's just the nutrition part. I would always just look at the ingredients, not just the nutrition facts, because those are also used for marketing, because it makes people say, oh, this is good for me, because it's high in protein and low in sugar, but always look at what you're eating. Go ahead.
Substitute I started eating and find tasty. Quinoa. Quinoa. I said, let me just try it. It tastes good.
Yeah, I'm glad you like that.
Yeah.
Awesome. That's an excellent example of one of the whole grains. And it's high in fiber
Well,
and high in
expensive.
protein. Yeah, and good protein in that too. Very good. Awesome. I'm glad you like it. Good.
I just have one thing to add. I kept my diet pretty much the same, but since I joined the senior center, I was exercising more and my sugar came down, thanks to John. He keeps us going. But
Thanks, John.
I think that activity is the key thing. If you exercise more and keep, if you indulge in something, go and exercise or take a walk, and it will bring your sugar down.
Yes, yeah. So again, back to insulin. Were you here day one, the first class that we had? When we talked about insulin resistance? I can't remember. It was the tornado day.
Yes.
Okay. I know we're missing some people for obvious reasons. So we talked about how insulin works, and we talked about exercise, and that doesn't require insulin to bring the glucose into the cells to be used. So exercise is insulin, basically. So it works just like insulin. So if you, like you just said, if you indulge in something, but then you go for a brisk walk, it's gonna work like you just took insulin. So the more you do that, the more natural insulin you have, and the better your blood sugars are gonna be. In the meantime, you still want to have the nutrition going because you want your insulin resistance to also get better. But yes, exercise literally is insulin.
I have a question
Yes.
for you. Because, thanks for reminding me, I didn't turn my phone on. The exercise before versus after eating. Because if you're diabetic and you exercise before you eat,
you get weak.
you have a problem.
Yeah.
But then you're saying if you exercise after you eat, it acts as if you take insulin. So that's like a catch-22 right there, isn't it?
The best thing to do when you're considering when to exercise, because again, everybody's different, right? Everybody takes different medications, everybody has different types of diabetes that work differently. Ask your doctor or your endocrinologist when they want you to exercise and if there's anything specific you should know about before or after you do. The biggest thing to do is take your blood sugar before and after. That's one major thing you can do. It really depends on the person as far as before or after, because before it can speed up your metabolism, after uses the glucose like insulin would. So it really is up to you and your medical professional when is a good time for you. Go ahead.
Yeah, the food,
Yes, you.
food supplies energy
Yes.
to exercise. Misconception is, I had a lady in my class, she's trying to lose weight, so she didn't eat anything.
Yeah.
Came to class and she went like that,
Oh, no. Yeah.
because she didn't eat. So
Yeah.
then I told her, you have to fuel the body.
Yes.
Supply the body with fuel to get through the exercise,
Yes.
especially when it's intense.
Yes. Absolutely.
Just getting up and running out of the house to get to a class. You know, and he could have eaten a couple of pieces of bacon and running out of the house.
Yeah.
It's not going to get it.
Right.
You got to feed the body.
Yeah, you're right. It's like a car, right?
Right.
If your car sits in the driveway and doesn't move, it's not really gonna need much gas, right? But if you're gonna be driving your car multiple miles a day, it's not gonna work without gas.
Right.
So you've gotta have the fuel in your body. And like you just said, I saw that as a trainer a lot. Especially the higher intensity classes where people would either throw up or pass out because they didn't eat, right? So you are definitely taking a risk by not eating, but I saw that a lot with weight loss people that, you know, hadn't been working with a professional where they ate less and then they just cardio, right? And a year later, they still looked exactly the same. And there was a reason, because they're slowing their metabolisms down by not eating and over-exercising. They're not building up the muscle, which is their metabolism. So anytime you're working on weight loss, it's always good to consult a professional and never, ever starve yourself. If you're looking to do intermittent fasting, work with a registered dietitian or a doctor to help you do it correctly, but it's not a good idea to do it on your own, especially with diabetes. Yeah, thank you for bringing up such good points, John. Any more questions about that? Okay, so we're gonna talk about some other key things that we need to know about to avoid complications. I don't remember if I brought this up in the very first class or not, but ABCs are something that we always want to monitor whether we have diabetes or not, especially if we have other chronic conditions. So I'm going to take this off the screen. Do you guys remember or you want to guess what A, B, and C stand for? It might be in your book, so you can cheat if you need to. What is A?
A1C,
Yep. B?
blood pressure,
C?
cholesterol.
That's right. So if you know those three numbers and you understand what they mean and you know how to keep them under control, chances of getting complications are far lower. But it's important to monitor those three things. And then I think I talked about vitamin D3 also. You might as well say A, B, C, D, but you want to have your doctor monitor your D3, your blood levels of D3. You don't want to just go buy supplements and start taking D3. You know, you want to know what your blood level is. So yes, A1C, and the goal of most doctors is to keep an A1C lower than 7%. If somebody is lower than 7%, not taking any medications, that's considered diabetes that's under control or in remission. But even if somebody is taking medications, they want you to stay under 7, typically. Not all, some doctors want you lower, but typically they want a goal of 7% or lower, which is an average of 154 for a glucose test.
Should
They
you
want
push
you
it?
under that to be considered under control diabetes.
Should you push it to try to get it low? Mine with metformin is 6. But I had the impression my doctor likes 4.5.
Right,
So even though I'm below 7,
yeah,
I think he wants me to get it lower.
yeah. So if you do have this in your book, which is good because you can refer to this whenever you want to, but session 1 goes over the numbers, and between 5.7 and 6.3 is pre-diabetes. 6.5 and 6.4 and higher is considered diabetes, and then anything under 5.7, you're not even pre-diabetes. So your doctor may tell you that they want your number at a certain level just for your overall health, to avoid diabetes. It's possible.
So I can't pretend that I don't have diabetes because I'm below 7 taking metmorphin. If I was not taking metmorphin, then I'd be okay. But because I'm taking metmorphin, I can't pretend I don't have diabetes.
I would talk to your doctor about that because it sounds like it's in very good control. And does your doctor know you're doing this class?
I don't think I've seen him since I started.
Okay.
I don't know that I told him.
Let him know that you're doing this, especially if you start making changes, because he may need to do an adjustment on your medicine once the changes start kicking in. You're gonna want him to monitor that medication.
I hate to say it, but I started reducing my cheer wine.
Oh, you hate to say that? I would think you'd be proud of
Oh,
that.
by the way, I also have lost weight since I haven't ended cheer wine, but I've reduced cheer.
Good job. That's awesome. That's a positive direction. Like we said, it doesn't have to be perfect, but all the changes add up, right? And you'll see further benefit from that too. It's just beginning. Good job. You might joke around, but you are listening. That's awesome. Blood pressure, the ADA, which is the American Diabetes Association, depends on which association you ask, but they want your blood pressure to remain 140 or 90 or lower, but optimal is 120 over 80. Right, that's like across the board considered optimal blood pressure. But the ADA says that your risk for complications when you have diabetes is if you keep it under 140 over 90.
I was in the sprint study at Duke, and they had 2 cohorts. One cohort kept it at 140. The other cohort they put me in kept it at 120. They actually ended the study because they found that those with 120 were doing so much better, they felt guilty about the cohort that was 140.
Wow.
So they say 120.
Wow. So they kind of felt like they were being unethical, it sounds like. Wow, that's powerful. I'm going to share that story. That was a study at
I
Duke?
did give that to my doctor. Yeah.
That's awesome. Okay. Yeah, that's why
It's called
120 over
Sprint,
80.
S-P-R-I-N-T. I think.
Say it again.
Sprint,
Sprint.
S-P-R-I-N-T.
Okay.
I'm sure you can Google it.
I'm gonna look that up. Yeah, thank you. That's very interesting. But that explains why 120 over 80 is considered optimal, right? People with blood pressure around there or lower tend to have less health complications. Yeah. And then cholesterol is another one. Some types of cholesterol are more protective. Can you think of the type of cholesterol that might be protective out of all those numbers on your lab work?
HDL.
That's right. HDL. So you can think of the H as like happy or healthy, and it will help you remember that's the good cholesterol. Typically doctors want that to be over 60 if possible, because that cholesterol's job is to kind of act like a vacuum cleaner and go through the blood and pluck out all the dangerous plaque. So that's what HDL does. So that's why we want that one higher, right? LDL, you can consider like lousy. That's not a good cholesterol to have high. Usually doctors want that under 100, right? And then triglycerides are not a type of cholesterol, but a type of fat. And they generally want those at least under 150, even better under 100. Anyone know how you can absolutely reduce your triglycerides?
Stop eating sugar. Because
Yep.
I ate candy and it was a little high, and I stopped trying my cheer wine.
Ah, interesting. Okay, so you're kind of using yourself as a guinea pig
It's terrible.
to test these things. Yeah. Yeah, so white stuff makes triglycerides higher. Yeah, like white sugars, added sugars, white flours. White flour acts like sugar. it does the same type of thing for inflammation and raising triglycerides. Do you guys know how the total is developed for cholesterol? You know how you always get a total? Do you know how that number is created?
I assume you add LDL and HDL?
You do. You actually add LDL and HDL and then 10% of triglycerides. So that's all part of that total. So like if you were to look at me, my total is over 200, but my HDL is 85. And that's part of that total. So even with like the LDL and triglycerides being under 100, it still puts my total higher than what, you know, doctors typically want. Exactly. So that's why we always want to look at the ratio and the breakdown. You never want to just look at your total and be like, oh, I have high cholesterol, because if you have high HDL, remember that's part of that total, right? And that's a good thing to have higher HDL. Any questions on that? How many of you have doctors or nurses or healthcare professionals that actually go through these individual breakdowns with you of your cholesterol numbers? Good.
Shows it to me.
Your cardiologist, good. That's good.
Mine shows it, but I haven't normally paid much attention to it.
Okay, well now you know what they mean. Yeah, because there's a lot of people, they don't know what the breakdown is, you know, and I think that's important, especially if you take medicine or you're trying to avoid taking cholesterol medicine. It's important to understand the breakdown and how to lower the bad ones and how to raise the good ones.
So to reduce triglycerides, you reduce white bread and things like that?
Yes, white flour and added sugars, white added sugars. It may not make it perfect, but it will lower it.
Because part of my diet is a white pita bread. So that is,
Yeah, but if your triglycerides are normal, I wouldn't worry about it. Some people have amazing genetics too, you know. I've seen people live to be 99 on no medications, eating horribly every day. I'm just not lucky enough to have genetics like that, so I have to try pretty hard, you know.
but the
It makes me so
lifestyle may
frustrated.
be good. The lifestyle may be less, less comfortable. They may be walking more and all that kind of thing.
Right.
But it's offset by the lifestyle.
Again, you want to be happy. You don't want to be stressed out about what you do every day, you know. So even if you make little tiny changes, you keep your pita bread, but you add more vegetables or you add more whole grains on the side, whatever, you know. Anything additional you do that's a healthy choice is going to make a difference. You got to be happy, not stressed. Yeah.
I know that one time my cardiologist told me I would eat sticks and drink water and I would still have, because part of it is also very genetic. Both on my mom and dad's side, they all had problems with cholesterol and heart disease, so.
Yeah, sometimes, no,
I mean, I was
yeah.
dealt a bad hand.
Yeah, I'll be the first to tell you, I have horrible genetics
Yeah.
for heart disease
Yeah.
and Alzheimer's too.
Yeah.
But I am also, I'm gonna tell you, it can be done still.
Yeah,
I'm the only one in my family not on a statin.
yeah.
And I'm talking about brother, parents, grandparents, aunts, uncles, cousins. Everybody takes a statin except for one. And my numbers were higher when I was in college because I didn't know any of this stuff. But now I know what to do, and that's, you know, the thing. It's just everybody has a choice, you know? And even in some cases, like my LDL is still higher than I want it to be. Even if I do everything perfectly, my LDL is still higher than I want it to be, but still not high enough to be on medicine.
Yeah.
But genetics can be very powerful when it comes to blood pressure, heart issues, and cholesterol.
Yeah.
So all we can do is try, right? That's all we can do. Yeah. So again, there's a lot we can do to prevent complications because we talked about in class 1, When you have diabetes, unfortunately, it does put you at higher risk for other chronic conditions, including heart disease, right? So, A, we work with our doctors to understand our numbers and keep them in a healthy range. 2, we learn how to live with it. We learn how to monitor our blood sugars. We learn what causes our blood sugar to come high. Is it stress? Is it the way we eat? Is it lack of exercise? We're all different, so we really need to learn what makes those numbers come up.
Excuse me, I'm trying to find a page. Is it in the book?
But the ABC?
Page 67 is basically starting to reduce the risk, and then it just goes all the way through. 69 is what I'm on now, but the book is more explanation than on the slide, so like when you go home later, just read through it, and it will just kind of be a review.
Okay.
Regular screenings and vaccines that are recommended by your doctor. Screenings are preventative screenings, right? Like if you never go to the doctor and you never take your blood pressure, we don't know if we have high blood pressure, right? We don't know if we have high cholesterol unless we go to our preventive screening. Checking your feet's important when you have diabetes too, because as you know, sometimes a little blister or cut can turn into a major issue. So you always want to check and make sure everything's clear and there's nothing that could cause pain. If somebody has neuropathy, they can't usually feel a cut sometimes, right? So by checking the feet, you can avoid a major problem. And then if somebody smokes, of course, that's going to put you at higher risk. So there's a lot of great programs actually for smoking too.
So I figure my not smoking makes up for my cheer line.
I'm just going to avoid eye contact. You know what's working for you though, which makes me very happy. You're actually seeing the results, which is awesome. So I probably don't have to spend a lot of time on this, but it's very important to know, especially if you're a woman, that sometimes your symptoms of a heart attack are not common. Like, you know, when we see in a movie or on TV shows and somebody has a heart attack, you can absolutely tell, right? They're clutching their chest, they're in a lot of pain, they, you know, sometimes fall over. But in many cases, women don't get those very common symptoms. So you want to look for things even like nausea or indigestion, which really can be a lot of different things, right? Don't think if you have nausea or indigestion, you're having a heart attack. But if you have it with other symptoms, there's lightheadedness, sweating, fatigue. A lot of times women will get pain in their jaw or their back. There was one woman in Eden, North Carolina that shared a story that I had never heard before, but she was having a heart attack, did not know it. Her son called 911, luckily he was there. She just thought she had indigestion. And when the EMS came, she just kept saying, I just need to burp and I'll feel better. Like she thought she had gas trapped and just needed to get it out, but it was a heart attack. And I don't even want to think what would have happened if her son didn't call 911. So like, when in doubt, call. And we're in Wake County. Don't we have, Karen, don't we have that 911 EMS thing where you can pay like $60 a year? Yeah. So you can pay $60 a year, and what does that do again?
Your
Ambulance rides?
ambulance ride, yeah, because on Humana, I know it's $325.
Okay.
Right. It could be more on whoever's insurance.
Right.
And I actually have more than one
here. I mean,
And
it's
you
not
can do
one and
It's
done.
not limited.
Yeah.
So really, there's no reason in this room to not call 911, even if it's a just in case thing, right? Go ahead.
See, indigestion mimics a heart attack,
It can.
because it happened to me.
Oh, it did?
Yeah,
Wow.
I went to the emergency, and it was, she was studying to be a doctor. What do they call them, interns?
Yeah, resident.
Residents. And Dr. Snow was coming through and said, this man's having a heart attack.
Whoa.
I never forgot his name. In fact, he became a cardiologist in Virginia.
Wow.
So he just walked in, and he recognized her. She was giving me those pills for gas,
For indigestion?
indigestion.
Oh, wow.
Next minute I knew it was shaving my chest.
Oh my gosh. That's pretty powerful. Yeah.
Yeah.
Yeah, so no matter what, it's always a good idea to be on the safe side, right? Like you had that gut feeling, I need to go to the emergency room. You always have to trust that gut feeling. And typically, not every time will be a heart attack, but at least you'll get checked.
Right.
Just in case, and the worst case scenario is the MS goes home, right? And you're fine, and you don't have to be
And you
transported.
go home.
And you can go home, exactly, yeah. So always, when in doubt, just call 911 anyway, right? Trust that instinct. Thanks for sharing that, yeah. Stroke, same thing. So I do Alzheimer's prevention in Burlington, North Carolina, and I felt so bad. There was a member in there, and she had a stroke and almost was like in denial. It's like she knew she had a stroke, but she didn't do anything about it because she didn't want to accept that she had a stroke, right? So she didn't go to the doctor until at least 24 hours later, to when the damage was done. So now she's dealing with vascular dementia for the rest of her life. So I'm not saying that to scare you really, I just want you to know the serious implications when you don't call 911, right? And these are symptoms of the stroke. If you were to have it yourself, so you can recognize it, if you see somebody, you can't tell really that they're having these things, but if you ask them to smile, typically won't be able to smile fully with both sides of the mouth. If you ask them to try to drink out of a straw, they won't be able to do that.
Yep.
But these are the things to look for. This is also in your book. Never take a chance, because if you get to the hospital within that window, it can be reversed and no damage. So never wait with a stroke, right?
I don't know if it's a Marine thing or a male thing or whatever, but I have a tendency to deny.
Yeah,
I don't have diabetes.
right.
Well, I do, but I
Yeah,
don't tend to. Cholesterol is another example. The doctor wanted me to take medicine. I think I refused for 2 or 3 years, saying, I don't need that, I'll get through it.
yeah.
And then I told him I was worried about, I'm getting my dad's age when he had a heart attack. And he said, well, Frank, that's what the medicine's for.
Right.
To prevent that from happening. So
Yeah.
there's a tendency sometimes for some people to just sort of, I'm okay.
Yeah.
Walk it
That's-
off.
That's real, that's true. Yeah, that's human. It really is, and I see it a lot. Yeah, thanks for sharing that. Go ahead. And I know, John, you had something too.
I have to tell my story because I had a stroke in 2008 and I did not know it.
Yeah.
My husband at the time was working at the golf course as a ranger, and on that morning, we brought my sister and my daughter back to the airport. They had to go back home. Came from Boston, and when I was driving back home, my husband said to me, "You're driving very erratically." So I said, well, I'm tired, you just have to get up real early in the morning. So I went to bed and he went to work, and when he came back at 5 o'clock, I was still in bed. So he woke me up, he said, "Are you okay?" I said, "No." I said, "Who are you?" I mean, I didn't even recognize my own husband.
Scary.
So he said to me, he says, "Can you, all kinds." He called 911 right away,
Good.
and the ambulance came, and at the time we lived in Greenmore, and the ambulance brought me at the fire department, and they helicoptered me to Duke.
Wow.
And I was paralyzed all on the left side, and they said, "You're gonna stay paralyzed?" I said, "Hell no, I'm gonna work at it." And
Wow.
yeah, so, a good thing he did that, because I did not, I did not know no signs or
Yeah.
so.
Yeah.
So I slept through it, but that's why they helicoptered me, so it would be faster.
Wow. Thank you so much for sharing that.
So
Because
that's-
that's possible too, to not
Yeah.
know you're having one.
Yeah, yeah.
And that's why it's important to be able to recognize if somebody else is having one, which your husband did.
Yeah.
Thank goodness he came home when he did, right? Because we don't always have that, right?
Yeah.
Where somebody else is right there, not long after. So, wow, your life is a blessing, isn't it? Yeah. Yeah. Go ahead, John. Thanks for sharing that.
Yeah, maybe you might know this. I have a friend that twice now has happened to her. First, her face was deformed, right? I forgot what they call it.
Bell's palsy?
Yes. And she was in class, and one of the ladies, Carol, looked at her and said, "Your face looks kind of funny." And rushed her to the hospital twice. She was misdiagnosed.
You
Right.
mean she had a stroke and they
No,
thought?
it looks
Oh.
like a stroke because
Yeah.
the face gets deformed,
Yeah.
which is part of what stroke does.
Yes.
Either
Yes.
you can drop her arm. I have a lady in my apartment building, started in her fingers. She couldn't pick anything up. And she
Wow.
had to take her in, and took her in
Yeah.
to the hospital. She had a mini stroke. You gotta be careful. Anything that's out of the ordinary to the body,
Yes.
take with caution and,
Absolutely. Yeah, I've heard that with Bell's palsy. I actually had it, believe it or not. It can be triggered by, I know. I had a lot of stress at that time. But a lot of people, when they get it, they think they're having a stroke.
Right.
Because part of your face doesn't work, right? Like you try to smile and it's like this, right? But it affects your nerves. In my case, it was an ear virus in my ear that I didn't know about, and it's caused swelling that pinched the nerve and shut down my muscles in the face. But yeah, it mimics a stroke for sure. So yeah, always be on the safe side no matter what, right? No matter what. Yeah, thank you guys sharing these stories is so important because it really shows how important it is to get that help immediately and go over symptoms, and you know, these testimonials are really helpful, so thank
Sometimes signs of a stroke, low blood sugar mimics some of those. Other than the numbness or one side of the body, but most of those others,
you. Yeah,
for sure.
yeah.
I have a funny story. I was having low blood sugar at my son's, but I kind of ignore it, like for whatever reason, it just slipped my mind.
Yeah.
So my son's wife is a doctor, and I said, something's wrong with me. They're going, well, what do you think's wrong with you? I go, I don't know, am I having a stroke or something? So they're going, blow your cheeks out, do this, do that. And they're like laughing at me. It was just low blood sugar.
Right.
But they're like, I'm like, you guys are really nice. I could be having a stroke and you're like, laughing at me, like, because I'm popping in the room.
That's so mean.
It is mean, you know?
But I think they probably knew you weren't just.
I know, I
because-
just got all panicky. I was like,
Right.
oh no, maybe I'm having a stroke. Like, no.
Oh my gosh, that's so bad.
I just thought that.
Why are our kids so sarcastic?
You're so cruel to us.
I know.
I have something I want to share.
Okay.
I had a stroke
Oh
years ago. I was actually in college, so I was really young. And I was a mature student, so I guess I was closer to my mid-20s, but I was still pretty young. And I just couldn't sit still. My nerves were all over the place. I couldn't sleep, I couldn't relax, I couldn't sit still. And of course, I had no clue as to what it was. I just couldn't sit still, I couldn't lay still. I was just constantly like, I was on something, if you know what I mean,
Wow.
right? I ended up going to the hospital, and they put me on beta blockers, but in the end, they ended up sending me to a specialist and told me I had a mild stroke.
Wow.
Yeah. So, just for those you think normal is a stroke.
Yeah.
Sometimes, I mean, I was just on the edge. And I was at college, I was working full-time and part-time, going to school, but, yeah.
Yeah. You never
You
know.
never know.
Yeah, so true. Thanks for sharing that, because
Yeah.
that's not even on the symptom list,
Right.
right? So that just gives us something else to keep in our mind, just in case somebody tells us that.
Right.
Thank you.
Especially that age. You
You never know.
Yeah, yeah.
I was working out, I was eating good, I mean, I was in great shape, I was working out like 5-6 days a week.
Yes,
You just never know where your ceiling is, when you're
No.
pushing your limits.
you're
You
right.
know, when you're dealing with expectations and, you know, trying to live up to everybody's expectations of what a young person is supposed to be. And I guess I'm sharing this not just because we're here talking about strokes, but because you never know when you're dealing with your children and your grandkids and so forth, what their limit is,
Yeah,
what that ceiling is, where, you know, the added stress and pressure of living up to everyone's expectations sometimes can send you to that point.
excellent point. And that's again why they call stress the silent killer, right? Because even if you guys applied all of this, ate perfectly, you slept fine, exercised regularly, if you have chronic stress, it's gonna trump everything, no matter how perfect you're living, right? So that's a very important story you shared, thank you. It's real. We all feel invincible until that happens and we realize we're human, right? Yes. Kidney disease, another complication caused by diabetes. So chances are if you have been diagnosed with diabetes, your doctor is monitoring your kidneys, either through blood or urine or both, right? There's not a lot of symptoms that you would notice and know that it's your kidneys because pretty much all of these can mimic 1,000 other things, right? But most of the time, again, your doctor has that under control if you have diabetes because they're monitoring that stuff. Go ahead.
Also, if you gather fluid in your legs,
Yes.
edema, that could be a condition of something's not working.
Yes, 100%. Yeah, kidneys, heart,
Right.
right? Congestive heart failure can cause that swelling. Yeah. If you get that swelling on a regular basis, make sure your doctor knows about it, 100%. Even if it goes away when you sleep, because the reason it goes away when you sleep is your legs are elevated, right? So the fluid just comes back into the body, but it's gonna come back down when gravity hits again, right? So yes, always tell your doctor about any unusual symptoms, anything that's abnormal for you, or even if you just have a gut feeling.
And weigh yourself every day. I think you guys need to do that here, right?
Yeah.
Yes.
Weigh yourself every day, that's an indication.
Yeah, absolutely. Thank you. Great
You have
tip.
any fluid around the heart or something like that.
Yeah. Heart patients, usually their doctors will give them a scale and the information just gets sent directly to the doctor if they gain a certain amount of weight. Yep. Eye disease, also common, a common risk factor with diabetes, which is why you should always get your eye screening done, right? Your insurance should cover all your preventive screenings, including this one. I know if you have diabetes and if you have Humana, you get all of your bundle done for diabetes checks, like your eye exam, foot exam, A1C, and kidney tests. And you get, was it $40? Depends on your plan. But just make sure if you have Humana, you're getting credit for your preventive screenings, okay?
If you're in the VA as well, it surprised me. I have diabetes. To me, it's very mild. But anyway, the doctor asked me, when was the last time you had your eye exam? And I said, 5 years ago, something like that. It's always the same. It's never been a problem. But as soon as he said that, he says, you have diabetes, you need to get that annually.
Good.
So then the VA, actually, surprised me, covered the eye exam because of my diabetes.
Awesome. Yeah, because if they can prevent something, it's going to save them money rather than having to treat it once it happens, right? Yeah, prevention. Neuropathy is another thing that can happen. Usually it happens more with uncontrolled diabetes, not as common if diabetes is controlled, but it can still happen even even with controlled diabetes. That's where it affects your nerves, your nerve endings. So it can cause pain and tingling and numbness. Eventually, in some cases, if it gets severe enough, it can affect the ability to walk. It usually hits the, furthest away limbs first, so the fingers and the toes and the hands and the feet. So if you notice anything like this, talk to your primary care provider. And also, if you have neuropathy, you're definitely one that's going to want to check your feet physically with your eyes every day. And if you have trouble seeing the bottom of your feet, you can use a mirror, right, to see that part, just to make sure there's no cuts developing or blisters or anything that could turn into something more complicated, right? Okay. So again, mindful eating. Anyone heard that term yet? Being mindful when you're eating? Yeah, most of you are nodding. That really just means, like, you don't want to eat while you're watching a stressful news documentary or something. In all honesty, it can affect the way you eat and how you digest your food. You want to be mindful when you eat, trying to avoid distractions. Because you tend to eat slower, you'll tend to enjoy your food more, and remember, it takes about 20 minutes for your stomach to get the signal to your brain that you're full. So if your food's all gone before that, you could end up overfilling yourself pretty easily, right? So we want to slow down, not be stressed if we can help it while we're eating, because that totally affects digestion. Because if we're not absorbing our food properly, what's the point in eating nutritious food, right? So mindful eating, thinking about hunger cues. Are we bored? Are we stressed? Or are we really hungry, right? And that's easier said than done. If you're an emotional eater, that's a tough thing. Questions or anything to share about mindful eating?
I have a question.
Go ahead.
So, most mature folks do not like to eat alone.
Yeah.
Okay? But that impacts lots of times when you want to eat around groups of people or other people, mindful eating. Because you have a tendency to socialize while you're eating, and when you socialize while you're eating, you end up eating more than you eat all the wrong things that you shouldn't eat.
That's true too.
So that's a little tricky area there. So what's the best way to try to approach that? Because you don't want to eat alone. And of course, eating alone forces you to be more mindful eater.
Right. But you're right. Most people don't. A lot of people don't eat alone either, you know? And honestly, I think eating in a social atmosphere is still mindful because you're present, right? You're not distracted. I mean, you are because you're talking to people, but you're not distracted in an unhealthy way, like where you're scrolling your phone or watching the news. You're still present with your friends. Yes, it can interfere with how much you're eating, but we still have a control over that, you know? That it's a tough one. That's a tough one, because if you're involved in conversation while you're eating, you might not be paying attention to what you're doing. But I'm never going to tell you eat alone, because that's not healthy either, right? Social connection is important.
I eat in front of the TV.
Yeah.
I just, portion my plate and then at least the TV's not coming in, because I'm all alone. I mean, I don't have no pets, nobody, so.
A lot of times, it's just doing what's best for you. You know, like if somebody's an emotional eater and they're watching the news and it's stressing them out while they're eating, I'm going to say don't do that, right? But if you're fine, you're not overeating, you're still able to eat healthy, and or you're with your friends and it's not an issue for you, again, if it ain't broken, don't fix it. Right? So if it's working for you, keep doing it. These are only changes if you feel like it's a problem for you, right? Something to try, to experiment with.
I'd like to share something. I would say 2 weeks ago, I was having issues with my knees, and so I went to the urgent care ortho to get some shots of these, and they gave me steroids. And I was told then to increase the insulin that I was taking to take care of it. Of course, I forgot that. But when I pricked my fingers to get my reading in the morning, I found out that it was 497.
Whoa.
After I almost passed out from that, I remembered that I was supposed to increase the insulin. But prior to that, which was about a week later, I had gradually gotten lethargic. I didn't feel. Everybody here would say to me, "You don't look good. You look like you don't feel good." Well, I didn't, but I didn't feel like I was sick, so I didn't do anything about it until the day that I saw that it was that high. I called the doctor, and she told me to increase the Lantus as well. And she also prescribed some, my other medication, more to take of that. And so now, today is the best day I've had.
Wow.
For you. I mean, I've
Happy
been
to
this
hear
for almost 2 weeks, and today is the best day I felt. Great today.
Wow.
But when I got up this morning and I pricked my fingers, it was 123. So
It's
So I don't, I don't know that anybody else has ever had that experience, but I just wanted to share it. And
Yes.
and you do have arthritic knees,
Yes.
and you go to get a shot for it. You might want to really pay attention to what the
Thank you.
Telling you.
Thank you for bringing
Good.
that up.
I didn't
Thank
realize
you.
that.
Yes.
And my doctor's talking
Steroids
about
can
it.
definitely
Steroids-
raise blood sugar.
Increases your sugar.
Steroids almost always increase blood sugar.
Yeah.
Nobody told me
Thank
that.
you for sharing that.
They've talked about cortisone shots, but they never said anything about how it might affect.
Yeah, it affects your diabetes.
My doctor told me to start steroids a couple of weeks ago and didn't say that the steroids would impact, even though all of my doctors have access to my charts.
It does.
I did change my doctor.
Ask them. Maybe there's a reason they weren't worried about you. Hopefully that's it. Hopefully
But
they
it should have
didn't miss.
been, there's a possibility
Yeah.
that
Yeah.
it should have been that little clause in there.
Yeah, to be on the safe side.
Yeah,
Yeah.
I had an ear infection and the doctor put me on antibiotic and steroids for just a week and also increased my insulin.
Okay, good. Good doctor. Yeah.
Yeah.
Yeah. That also is why I think we talked about endocrinologists managing diabetes instead of just the primary care. And primary care doctors do a great job, in many cases too, but an endocrinologist is more of a specialist to manage diabetes. So if you feel like your diabetes is not managed properly, maybe ask for a referral for an endocrinologist to make sure that you have a specialist. Just like if you have a brain issue like dementia, you want a neurologist, right? If you have a heart issue, you want a cardiologist. You want a specialist that specializes in what you have. So that's important, and that's an important point too. So I'm gonna say, let's set a goal for next week. I'll see you again. Next week, we're talking about medications. And we're actually going to go over the most commonly prescribed medications. We're going to talk about common side effects and how the medications work. And we'll probably have a good conversation about that too. And we're going to talk about stress, because I think we did discuss how stress and sickness can also raise blood sugar, right? So a lot more stuff to cover next Wednesday, but you can start reviewing if you want. On page 89, it talks about medications, but I am going to tell you, your homework is to go through sessions 1 through 3, hopefully before next Wednesday, so that we're all kind of have that history behind us and we can just review and make sure we're all up to par. That way, if you have questions before our last session, or your last session with me, we can get those answered. Okay. Somebody had a question.
No,
Yes.
I want to let everyone know there is a pharmacist on call here
Right,
that can review all your medications.
I forgot about that.
Right? So
Yeah.
if you want to take advantage of that.
Yes.
sign up.
There's a pharmacist that comes to visit here at no cost, right?
Yeah.
No cost, and they can review your medications with you and look for red flags, maybe talk about supplements too, if you're taking supplements. Yeah, thank you for bringing that up. There's a lot of good resources here. It's a good county to live in.